Well, we might look to get underway if we can. So I wanted to welcome our speakers who we've seen on their screens. It's very nice to see their faces. And of course, to welcome you all to our first seminar for the year for CRE Respond. It's the Centre of Research Excellence focused on optimising, personalising antimicrobial dosing to reduce resistance. So we have an education program which we run through the year, tend to have somewhere between 8 and 12 educational webinars or workshops or even small conferences. And over the last 5 years or so, we've been able to provide education to over 4,000 people, generate over 100 YouTube videos, which is available if you search for the name of our centre in YouTube, and it has lots of fantastic and interesting presentations. But none of them are necessarily any better than those three that we're going to be able to listen to tonight. We've got three fantastic speakers from around the world, and I can see some of them smiling, feeling a little bit uncertain about that compliment, but trust me, your backgrounds all make me very excited about what we're about to hear from you. So the whole topic for today's webinar is on models of care for hospital in the home. So this is a really interesting area to me because I think that from an Australian perspective, there are many different ways in which hospital in the home care can be provided. And what makes this particularly interesting is that we're always looking to evolve and improve what we do. So understanding what's done in other countries and how they've evolved their practice can only but help others. So it's my pleasure on behalf of my team here at the University of Queensland that we can start this session off. So my name is Jason Roberts. I'm a pharmacist by training and I'm the Director of CRE Respond. One thing that I would like to do before we introduce our chair for this evening is I'd just like to give an acknowledgement of country, which is something which we do in Australia, just to acknowledge the traditional custodians of the lands on which we meet. It's considered to be an appropriate cultural recognition for the traditional custodians of the lands. And so I pay my respects to elders past, present and emerging, and I acknowledge their valuable contributions to society. So tonight's chair is going to be Dr. Fekade Sime. Fekade is a real leading researcher in the field of OPAT and hospital in the home, particularly in the area of antimicrobials and designing regimens and data which can ensure the optimal use of antimicrobials in the outpatient setting. Fekade is an NHMRC Emerging Leadership Fellow. It's a very competitive and difficult fellowship to get and speaks volumes about his wonderful capacity as a researcher and a pharmacist. So I'm going to hand over to Fekade now and allow him to introduce the other speakers. Thank you.
Thank you, Jason, for the kind introduction. So good morning, good afternoon, or good evening, everyone. So in the next 1.5 hours, our aim is to discuss the various models of care in hospital in the home program across the world. We have a line of speakers from Malaysia, Spain, and the UK. We will be discussing emerging programs in Malaysia to already established programs in Spain and the UK. So we have 20 minutes allocated for each speakers, and the talks are organized back to back. And at the end, we will have a 20-minute session for questions and discussions. So we value the expertise and insights of all the audience participating in this seminar tonight. So I would encourage you to actively participate in the question and answer session so that we can make these sessions not only informative, but also inspiring for all of us.